Hi, good day everyone. If I have sinned further, it is by standing upon the shoulders of giant, Sir Isaac Newton. Today we are going to discuss on citing earlier work. This is MQB7001 research method. Hi, I'm Professor Dr. Victor Ho from the Department of Social and Preventive Medicine, Faculty of Medicine, Universiti Malaya. Why should we cite earlier work? Attribution serve as a fact-checking tool. Citation makes you a better researcher. Good citation practice makes you a better writer. A good bibliography shows off your scientific knowledge. Careful citation practice will build your credibility as a scientist or scholar. And citation enables better verification of your work. How should we cite? How do I avoid plagiarism? Read and understand before you cite. You should not cite just by browsing it. You must understand the whole paper before you want to cite it. Understand what is the message the author wants to share, and internalize the idea and put it in your own words. So you got to read, understand, and internalize. Totally internalizing the idea that the author are presenting. What is plagiarism? Simply, plagiarism is to copy, repeat, fake, borrow, or steal someone's work. It is derived from the Latin word to kidnap. Collusion. This is where you are working with one or more other people when you should be working alone. Copying. When using someone else's work without giving reference to it. Paraphrasing. This is reading someone else's work and then writing it out in your own words without giving due reference to it. Using your own work without proper citation is also a form of plagiarism. So you should cite your own work. It can include resubmitting an entire paper. That means you have submitted a paper earlier to another journal and you resubmit it to the new journal. Is a form of plagiarism. Copying or paraphrasing passages from your previous work without due and proper citation. This is called self-plagiarism. Where should I get information from? That means where should I get the information so that I don't plagiarize? This refers to when you're reading a paper. Abstract, introduction, methods, result, and discussion. So this is how a paper is normally structured. So where should we get the information from? Is it from the abstract, from the introduction, from the method, from the result, or from the discussion? We should never cite from only reading the abstract alone. You must always check the fact in the full paper. Introduction only is good for inspiration. It is not the author's work. Read the original cited work instead. Methods. You cite the methods when information is a method if you are using the same or similar method for your paper. If you are not using a similar method, the information in the method section is for you to check the validity of the result of the report. That is, the paper that you are reading, whether the result is valid based on whether the method is valid or not. Result. Citing a result is about citing fact or what the researcher has done. Citing the findings of the research. So it is where you're supposed to cite and read the result, understand the result, and cite from the result. Citing from the discussion is not about the result of the paper, but about the opinion of the author. Because the result presents, the result presents all the information, all the data that you need to digest and analyze, and then the author takes the data from the result to give his own opinion of the result that he found. To be a good at citation, you don't cite the opinion unless the information, you should only cite the information in the discussion if you value the thoughts of the author, or the author is an authoritative figure in your field. Hierarchy of evidence can be systematic review with meta-analysis is the highest. Then it comes down to systematic review, narrative review, original research, case report, case study, and expert opinion. You must understand this for you to be able to find the correct paper and which paper to cite. So the first thing you want to look for is whether there is already a systematic review with meta-analysis. If there's no systematic review with meta-analysis, then you can look at systematic review. And narrative review, although it's higher up the original research, you need to take it with a grain of salt because it has not gone through a systematic manner of assessment. So the information provided in the narrative review might not be 100% accurate because it is the opinion of the author. Of course, original research, as we mentioned just now, you need to cite from the result section. Case report and case study is only for you if you want to put this in your introduction to say that there are cases like that and we want to continue, or put it in your discussion session, not part of your literature review or other part of it. And of course, expert opinion is also one of the things that you can cite. But you should start off with systematic review with meta-analysis to find the correct and the most higher hierarchy of evidence. So, as mentioned about hierarchy of evidence, I have told you the importance of hierarchy of evidence in citation. So, think about it and go back and make sure that when you are looking for papers, start with systematic review with meta-analysis if the paper is available. Examples. This is my research, determinants of multi-site musculoskeletal disorder among school teachers in Malaysia. Outline of chapters that was in my research. So if you look at it, there are many chapters. Chapter 1 is introduction, chapter 2 is background. I put in the background because I want to provide more information to the examiner. This research report was written as part of my Masters in Occupational Safety and Health, which I took in University of Turin in Italy. So to provide, this is what I want to provide background for the readers in Italy to understand Malaysia school system, and of course the data that I was deriving from the research, where the data I derived from, which is the cluster survey. And you see the literature review. We started off with introduction to burden of musculoskeletal disorder, burden of musculoskeletal disorder among workers, summary of the burden of MSD, risk factor of MSD, then you have summary of risk factor of MSD, multi-site pain, you have summary of finding of multi-site pain, musculoskeletal disorder among teachers, risk factor among teachers, individual risk factor, workplace physical, psychosocial risk factor, and musculoskeletal disorder among teachers in Malaysia. So you need to be able to develop a structure of how you want to write your literature review. But this is going to be on literature review, so go to the literature review lecture. Let us just focus on 1 or 2 paragraphs in my introduction. Alright, this is my introduction. Okay, it reads, work-related musculoskeletal disorder are the most common occupational disorder around the world and have been recognized as a problem since the 17th century by Bernardino Ramazzini, the father of occupational medicine, where he observed that a variety of conditions were caused by prolonged, violent and irregular motion and prolonged posture. He also observed upper limb problem among professional writers, where the risk was prolonged static posture, high repetitive work and attention to details. Second paragraph, MSD include a wide range of inflammation and degenerative condition affecting the muscle, tendon, ligament, joints, peripheral nerve and supporting blood vessel. MSD can be divided into specific conditions with clear diagnostic criteria and pathological findings, and a non-specific condition where the main complaint is pain, tenderness or both, with limited or no pathological findings. Example, low back pain or neck pain. Now let us review these 2 paragraphs and think where we need to put in the references. Alright, let us move to the next part, and I'll show you where I have inserted the references. The first sentence, we have 2 references, one coming from the Ramazzini, the disease of workers, translated from Latin text, De Morbis Artificum Diatriba, 1713, New York, Hanfer Publisher Company, 1964. We also cited a more recent publication, which by Franco G. Ramazzini, Bernardino Ramazzini, the father of occupational medicine, published in American Journal of Public Health in 2001. So these 2 citations provide us with the foundation or the basis for us on the first sentence itself. So although the first sentence is a known fact, but you still need a citation to support the fact, this known fact. So it's important for you as the researcher to actually include this and think of it whether the information needs a citation or not. Then we move on, alright, where we continue to use the second paper to provide us with information on what was said, alright, what was mentioned and what was discussed. So it is important for us to actually also understand that. And moving on, we move to another paper by Barker P., which is talking about work-related neck and upper limb muscular disorder, Luxembourg, European Agency of Safety Health at Work 1999. So this paper actually did continue to look at the other issues. So looking at the first paragraph itself, we have 3 different papers to support the information in the first paragraph. So it's important as a scholar, especially as a scholar starting out their research, to include citation if the information is important. All right. And if you look at the way it was written, it is written very succinct. That means only information that is required, and very compact. So that's why there are 3 papers to support the first paragraph. In the second paragraph, the first sentence, we again use 2 citations or 2 journals to support it. Right? The sentence, the 2 papers are Nature of Work-Related Neck and Upper Limb Musculoskeletal Disorder, and the other paper is Work-Related Musculoskeletal Disorder, the Epidemiology, Evidence and Debate. So these 2 papers, we have looked at it and we have said that the information in these 2 papers support the information there. One of the paper might just support musculoskeletal tendon, or one of the support must just look at inflammatory or degenerative. But at the end, these 2 papers discuss on the issue. That's why we use the 2 papers to support our introduction, second paragraph, first line. Then we move on to the last line of the second paragraph, where we again cited 3 more papers to support the information provided there. So from this short 2 paragraph, you can see that there is 8 citation to support the information there. But it's not that the 8 citation is a normal practice. It is because this 2 paragraph is written very, very compact and very succinct, where there's a lot of information in that, and this information are derived from those 8 papers. So we would teach you, or you have already learned about write literature review and how to write a literature, and that is what you need to do. You need to understand that you need to write in a scientific writing. For scientific writing, you need to be succinct. Succinct means short, to the point, and the information is enough for there's direct information. It's written very, very clear, and that is the main thing that you need to do, and it's supported by evidence. So this is the first 2 paragraphs of my introduction for my research report for the Master of Occupational Health in Turin, University of Turin in Italy. Let us do some exercise. Mistakes that you should never make. Let us look at this paper. Identify the mistake. So the sentence says, unfortunately, primary healthcare workers are overworked and understaffed and face workplace overcrowding. Primary healthcare clinic deals with specialized clinics such as methadone therapy, quit smoking, and many more, which are micromanaged at the primary care level. In conjunction with this, a high workload decreased workability. So let us look at the paper itself. The paper is, look at the paper, title of the paper, right? Physical workload, obesity, have a synergistic effect on workability among construction workers. So where is the information on healthcare worker? The information of a healthcare worker is most probably derived from the introduction. As we discussed earlier, you don't take information from the introduction. You take information from the result itself. The paper look at physical risk factor and obesity on work ability among construction workers, is not among healthcare workers. Alright? So don't make this mistake. Alright, let us look at the mistake. Alright, this is the text or the description of the mistake. Alright, in conjunction with a high workload, decreased work ability, although the findings from the study indicates that high workload associated with decreased work ability, the study focused on construction workers, as I mentioned earlier, and not healthcare workers. The writing is misleading and it indicates that Tono 2019 looked at healthcare worker. The second issue is the information results did not show decreased work ability. Rather, the term used was exposure to manual material handling, strenuous work, and also risk of poor and moderate ability. Alright, so a lot of information inside there, but it's important that this information are not related to healthcare worker. The information is presented wrongly. So that's why we mentioned earlier that you must read the whole paper, understand the whole paper before you cite them. Let us look at another one. Alright, primary healthcare workers in an urban setting deliver their services with limited staff. UNOS et al. 2017. Inappropriate salaries, inappropriate incentive during weekends and public holidays that need to better maintain. The UNOS paper is the role of quality nursing, work life, and turnover intention in primary healthcare services among registered nurses in Selangor. Let us look at what are the mistakes. Alright, so the mistake is deliver their service with limited staff and appropriate salary. The studies did not assess the number of staff or ask about salaries. Rather, it assessed the quality of work, life, and turnover intention. The writing should be based on the evidence and not twist the evidence to suit your report. Alright, so be careful. That's why I say you must be careful and never make this mistake in your write-up. Let us continue. Right. Furthermore, there is plenty of record keeping called written or written at the primary care levels to achieve their KPI, key performance indicator. Most workers complete their written during work non-working time, compromising their personal family life. Constant exposure to such limitation would harm primary care worker physical and mental well-being, impacting quality of life. So the paper is on, let me say again, psychosocial work condition and quality of life among primary healthcare employee, a cross-sectional study. Let's see where's the mistake. Alright, so TELUS 2004 conducted among primary healthcare workers of medium-sized city in Brazil. The study assessed quality of life using WHO quality of life, brief general quality of life, as well as physical and psychological, social and environmental domains. The study used the effort reward imbalance model to investigate the psychosocial work condition. There's no reference to a type of work indicated in the paragraph. The reference still can be used, however, it needs to be written focusing on effort reward imbalance. So you are translating the information in the report and twisting it so that it fits into your research or your paper. That is a mistake that you should not make. The advent of new government-led changes in the healthcare system, which could impact primary healthcare practitioner, work ability and overall well-being, resulting in occupational fatigue, implementing a shift system at primary care clinic without sufficient resource burden the staff involved, an imbalance between job demand, job control and knowledge disables healthcare workers from coping with their daily work process. Lack of staffing levels, heavy workloads, unfavorable working environment and organizational contribute significantly to the fatigue among healthcare workers. They too are constant under significant pressure concerning healthcare worker and responsibility. So it's a multi-level approach to individual and organizational predictors of stress, fatigue among healthcare worker at a university hospital, a longitudinal study at the C. Western Institute. So, almost Salama 2022, the study was conducted among hospital healthcare workers in Paris and not on what is happening in Malaysia. The way the sentence was written indicate that it was talking about the issue in Malaysia. You need to provide reference from Malaysia with disregard of the issue. So you understand the problem. You are using information from another country with another system which is different from Malaysia, and then you transport it into Malaysia without informing or providing information that this is not from Malaysia. So it's dangerous and it's wrong. So how can you make it better? What are you going to do to ensure that your citation is correct, to ensure that the things you do are correct? How can you make this better? Let's read this. Research conducted among Brazilian education administrator workers found that 13.9% had reduced work ability. Meanwhile, good work ability of 77.3% has demonstrated among Brazilian hairdresser workers. On the other hand, a study conducted among hospital nurses reported 47.45% good work abilities. Recent study conducted in Brazil among community health workers showed 25 systematic review. Meta-analysis proved that 1/4 of the hospital nurses staff had reduced work ability. Do you understand what they're saying? Actually, they presented a lot of information with a lot of citation. Let us look at what is the issue, all right? And how can you make it better? So, making mistake is better than faking perfection. Perfect does not mean perfect action in a perfect world, but appropriate action in an imperfect one. Thank you very much, and I hope that this will improve your journey as a researcher, and you will improve how you are going to cite. Thank you.